Today we are going to discuss hemostasis. And when you study as year 1 MBBS, then it's very much confusing during exams because they often confuse as homeostasis. Remember, homeostasis is maintenance of internal environment, while hemostasis is the arrest of bleeding or stoppage of bleeding, right? So in this hemostasis, there's two things. One is that it maintains the blood in the liquid form, and second, it stops the bleeding, right? So when we have to write a hemostasis as a short note or long questions, you have to remember that it has got three things. One is, first thing is, whenever there is any bleeding point or any tissue injury, first thing there will be vasoconstriction. The next thing there will be platelet plug formation. Platelet plug, which we call as primary hemostasis. Primary hemostasis. And lastly, it is formation of the permanent clot. Permanent clot. That is, we also call the secondary hemostasis. So these are the three things that are the main steps in hemostasis. There is vasoconstriction, platelet plug formation or primary hemostasis, and secondary hemostasis or the permanent clot formation by formation of fibrils. So what are the other three factors that basically, what are the three things that play a major role here? Number one is endothelium. Number two, the platelets. The endothelium, platelets, and then there's coagulation cascade. Coagulation cascade. So these are the three basic role players that play in this whole system of hemostasis. Okay. So before we go to the procedure, let's understand a little bit about endothelium. Now remember the inside of the blood vessels. Now if you see the inside of the blood vessels, okay, so inside of the blood vessel there is a lining of cells which are called endothelium. Okay, so this is the endothelium, and the inner lining of the organs is called epithelium, and inner lining of the blood vessels, they are called endothelium. So this is called vascular endothelium. So what is just next to the vascular endothelium? There is a layer of basement membrane. Okay, there is a layer of basement membrane. So endothelial cells, then layer of basement membrane. Then beneath the basement membrane, there is a layer of collagen fibers. This is the collagen fibers. Collagen fibers. And then finally, the outermost layer, that is the smooth muscle cell layer. Okay, then the outermost, there is the smooth muscle cell layer. So when you are saying that when there is a rupture or tissue injury, or when we are trying to understand the hemostasis, we have to keep it in mind that we are talking about actually four layers, right? So first layer is this is the vascular layer. This is a vascular endothelium, which is composed of endothelial cells. Next, there is the basement membrane. Then this is the collagen fibers, and then this is the smooth muscle cells. Okay, so these are the four basic things that are playing a major role in hemostasis. Now this is a normal endothelium, normal blood vessels. Okay, but whenever there is any injury here, any injury in this endothelial cell layer, this is the blood flowing in the blood vessels. When it is exposed to the collagen, then the hemostasis process starts actually. Okay, so there will be no hemostasis process going on until and unless the blood is not exposed to the collagen fibers. Okay, so means what I am trying to say here. So let's say this is an healthy normal endothelium, and in contrast this is a breakdown in the endothelium. This is the broken endothelium. Okay, this is an injured endothelium. So when there is a healthy endothelium, so blood is moving in a liquid state. It's in a liquid state. Okay, there is no hemostasis here. And remember, when this hemostasis process going in a pathological way, we call it a thrombosis. And when there is an injured endothelial, means what? Means when this blood that is flowing here, it is exposed to the subendothelial matrix. This is a subendothelial matrix which is composed of the collagen fibers. Then the whole hemostasis process starts going on. Okay. So as we know, the first process is vasoconstriction. What happens in the vasoconstriction? Whenever there is any injury, any bleeding point, the first step, that is the vasoconstriction, means there is the blood vessels, they vasoconstrict. So there will be vasoconstriction. There will be vasoconstriction. Okay, there will be vasoconstriction from both sides. They will try to they will try to narrow themselves. Okay, it can be because of reflex mechanisms, neurogenic mechanisms, and it's also because of this damaged endothelium. They secretes one thing we call endothelin. These endothelins are also responsible for vasoconstriction mechanism. So the first step in hemostasis, that is vasoconstriction, it is because of the reflex neurogenic mechanisms. Okay, and next is, this is because of endothelins, which are released, as the name says, endothelins. They are released by the vascular endothelium. Okay. Next we go to the, after vasoconstriction, what happens in the damaged endothelium is the formation of the platelet plug. Second step is formation of platelet plug. Now what are these platelets? These platelets are tiny bits and pieces of megakaryocytes coming from the bone marrow. Okay. So let's say first you have to understand the structure of the platelets. Remember, as we go on hemostasis, platelets have two receptors. Okay, this one receptor is GP, glycoprotein GP2A, and another receptor it has got GP2A3B complex. Okay, so one is this is GP2B and this is GP2A3B complex. So, and inside the platelets there are granules. Again, platelets have two kinds of granules. Some granules are alpha granules and some granules are delta granules. Okay. The alpha granules, they are mainly required for adhesion. They have adhesions. They are responsible for adhesion, the alpha granules. Okay, and they also release adhesions. They also release what is called this platelet-derived growth factor, transformation growth factor, and von Willebrand factor. So these are found in alpha granules. While the delta granules, they release ADP, they release calcium and serotonin. These things are released by the delta granules. And remember, calcium is very important for intrinsic for the clotting cascade. Okay, for the clotting mechanism we need this background of calcium. Apart from this, these platelets, they also release phospholipid complex. They release phospholipid complex. Which is also a very important part, which takes place very important part during clotting mechanism, the phospholipid complex. Discussing this formation of the platelet plug, we have to know a little bit about the platelet. That, as we said, it has got phospholipid. It has expression of phospholipid surface or phospholipid complex, which may play you can say it plays a foundation for clotting cascade. And it has got two receptors, surface receptors, GP2B and GP2A3B, which we'll discuss in next moment. Okay, which you're going to discuss it. Alright, so now what happens? How this platelet things comes out? So whenever there is any injured endothelium, let's say this is the injured endothelium. Okay, injured endothelium means what? Injured endothelium means when these collagens are exposed to the blood. So this collagen material or the subendothelial matrix, they are exposed to the blood flowing here. They are exposed. So once they are exposed to the flowing of blood, what happens? Now there is an important factor that comes to play is von Willebrand factor. So these are von Willebrand factor, VWF. They comes in this damaged endothelial layer. Now remember, platelets basically they do this whole thing of hemostasis by three ways. Okay, but they have got three functions. So first thing, they have the property of adhesion and change of shape. Adhesion and shape. So they have adhesive property, and their first thing, they will adhere here, and then they will change the shape. Then next is the secretion part. They will release the granules, and third is the aggregation part. Aggregation. So we're going for one by one. First is the adhesion and change of shape. So whenever there is any damaged endothelium, first thing what happens, von Willebrand factor, that is the glycoprotein present in the plasma, and it is also expressed by the platelets. Okay, it makes the basic foundation in the damaged endothelium. Now remember, platelets are flowing here. These are platelets. They are flowing in the blood. They cannot adhere here. Blood is going in a high speed. They cannot just adhere to these collagens. So platelets can adhere only because of the von Willebrand factor. Means von Willebrand factor plays a mediating role. Okay. So these platelets which have GP2B, this GP2B, it combines with the von Willebrand factor. Okay. So GP2B. So this GP2B, it combines with the von Willebrand factor. This GP2B means GP2B combines with von Willebrand factor. That is the equation. So GP2B, that means platelet combines with this, through this GP2B, it combines with von Willebrand factor, and this von Willebrand factor in return, it will get attached to this collagen fibers. So that's how platelets is being adhered. Okay. So platelets adhere because of the presence of the GP2B. So here comes two factors. We are talking about von Willebrand factor. In some patients there is genetic deficiency. When this von Willebrand factor is deficient, then we call it the von Willebrand disease. And sometimes some people are also genetically deficient in this GP2B. When this GP2B is genetically deficient, then we call it the Bernard-Soulier disease. Bernard-Soulier disease or syndrome. So in Bernard-Soulier disease syndrome, people are deficient in GP2B receptors. So as a result, in those people, platelets cannot adhere. So they are having bleeding tendency because platelets cannot adhere. Okay, they cannot be sticking here. So if platelets cannot stick to the injured site, there is no formation of platelet plug. So that is about Bernard-Soulier syndrome and von Willebrand disease. So these two diseases can result in a defect here. Alright. So because of GP2B, now platelet is being adhered to the injured site. Once this platelets is collected, so let's say these platelets are now being collected. Now platelets, when they are flowing, they are being collected. Now remember, it's a high shear force. The blood is in a high speed. So platelets need to be adhered like in a tight glue fashion. So that's possible because of the von Willebrand factor and the GP2B receptor. So platelets are being adhered here. Now once the platelets adhere here, what happens? Okay. So next is the secretion. Now next part is secretion. So they release these granules. So these granules are being released. One is alpha granules, one is delta granules. So alpha granules release all these adhesion property things, factors, and delta granules release all this ADP, calcium, serotonin, histamine, all these things. Okay. So once these granules are released, now what happens? Now remember, these platelets, now they are going for aggregation. They are aggregated. So each of the platelets is attached to the another platelet. How they are attached? So each of the platelets is attached to the another platelet by mechanism of fibrinogen. So these are fibrinogens. Fibrinogens. They are attached to each other by fibrinogens. Now these fibrinogens, they attach each of the platelets to each other by means of another receptor that we are talking about here, GP2A3B receptors. This is GP, glycoprotein GP2A3B 3b complex. So because of the presence of GP2A 3b complex receptors in the platelets are adhered together by the fibrinogens, by the presence of fibrinogens. Remember, these fibrinogens are also expressed by the platelets in the alpha granules also. They also express fibrinogens. Okay. So now these fibrinogens are putting all the platelets together. Okay. Sometimes in some people they are genetically also deficient in this GP2A 3b complex. Okay, so GP2A 3b complex. So that disease, when they are genetically deficient, we call it the Glanzmann thromboasthenia. It also comes sometimes as 1 mark question as MCQ. Glanzmann's thromboasthenia. So Glanzmann thromboasthenia is that condition when people are genetically deficient in this GP2A 3b complex. So if GP2A 3b complex is deficient, then platelets cannot adhere again, right? So they lose their capacity to aggregation. They cannot be aggregated in one place. So again they can have bleeding tendency. So once this platelets are now, once this vasoconstriction is done, then the platelets are now collected here. By first they'll adhere, then they'll secrete the granules, then they'll aggregate. Now once the platelet is there and they are formed, they are collected together by the fibrinogens, now it's time for starting of the coagulation cascade. Okay. So third phase is the clotting mechanisms. Clotting mechanism or the clotting cascade. So when we discuss the clotting mechanism or clotting cascade, remember we have to know that there are two ways. Okay, but though there is the two mechanism of the clotting cascade, they finally come into one pathway, and both the things occurs. So we have intrinsic pathway, and we have extrinsic pathway. Extrinsic, like when it is outside the blood vessels, in tissue factor, when there is the damage of tissues. Okay, so and when you write the clotting mechanism, you always write in Roman numerals. This is because there is factor 1 to factor 13. Okay, there are 13 clotting factors. So we start with factor 12. Remember, it's not the difficult thing to remember. Just you write it from the up to down, from 12 to go on. Okay, so 12 is activated to 12A, which will activate from 12. It go down just 11 to 11A. Okay. Now 11, after 11, don't write 10. That is the only difference. Just write 9. 9 to 9A, and 9 will activate 10 to 10A. I'm just writing a simplest form. Then I'll make it complicated. Okay, then this 10A will convert prothrombin to thrombin, and this thrombin will convert fibrinogen to fibrin. Okay, we make it like this. So this thrombin, now if you remember, the platelets are already there. Here these are the platelets which are bound by fibrinogen, So bounded by fibrinogens. So this is the fibrinogen. So once this thrombin is formed, it will convert these fibrinogens. It will convert this fibrinogen to fibrin threads. So once the thrombin is formed, this thrombin will convert this fibrinogen into fibrin threads, and there will be permanent formation of the clot. You will find thread-like structures. Okay, so that is the, now it is together, we call it a clot. It is solidified. Okay, let's start from the top again. So it starts with factor 12, 11, then don't write 10, just go to 9. 9, 9A, that is activated, then 10 to 10A, prothrombin and thrombin. Thrombin will convert fibrinogen to fibrin. That is the final stage product, fibrin formation. When there is a tissue damage, then there is a formation of tissue factor. Tissue factor. Okay, tissue factor combines with factor 7. Tissue factor combines with factor 7, and it directly stimulates this step. It can come directly. So when it comes through the direct, it bypass all these reactions, means 12, 11, 9, these three things are bypassed, and it comes directly join this step, and we call it the direct pathway or extrinsic mechanism. This is the only difference between extrinsic and intrinsic. So whenever there is bleeding, remember both the things happens. Both the things happens. There is a formation of clot by both the means, intrinsic and extrinsic means. Okay. So this thrombin will then convert fibrinogen to fibrin. That is the final product. Now, apart from this, what else are the two factors we require here? This calcium, it plays vital role. Without the calcium, this clotting cascade cannot progress. Who provides the calcium here? Remember, is the platelets. The granules present in the platelets, they provide the calcium. Which granules? Dense granules or delta granules. Delta granules. They provide the calcium. Another thing is that, as we discussed, that in the platelets, they also produce one phospholipid surface. They also produce a phospholipid. So this phospholipid surface, phospholipid complex or surface. So where are they? This phospholipid complex or surface, they provide this basic platform where the prothrombin can be converted to thrombin. So because of this phospholipid complex provided by the platelets, clotting mechanism, this vital step, it takes place where 10 can activated factor 10 converts prothrombin to thrombin. So because of this. So this is the clotting mechanism. It's not so difficult. Don't try to remember it. Just start from 12 and go. This is the simplest clotting mechanism cascade. Okay. Without any other things, I'm just trying to make it simple with the help of calcium and phospholipid complex. Now this is the clot. What is formed here? This is the clot. Now this clot is inhibited. So once the clot is formed, it should be removed, or it should be cleaned, or it should be broken down into pieces after a few days. Otherwise, it can do some pathological reactions. So this clot is usually inhibited. Now, the question comes? What are the things that are present in the blood which play as anticoagulant or anti-clotting factors? So you have to remember this thing. The number one is antithrombin. Antithrombin. Number two, these are vitamin D, vitamin K dependent factors, protein C and S. Protein C and protein S. And number 3 is plasmin. And number 4 is fibrin degradation products, FDP. So when the fibrin is degrades, just some products, the small products liberated by the breaking of the fibrin, they also act as anticoagulant. So in our body, in the blood, we have these things also, and we have also normally we have also some prostacyclins, that is prostaglandins and nitric oxide. So this prostaglandin and nitric oxide, they not only act as vasodilators, they are also anticoagulant. They keep the blood in liquid form. They don't try make the blood to coagulate. Okay. They are platelet inhibitors. Platelet inhibitors. They inhibit the aggregation of the platelet. So these are anticlots. So when a clot is formed, this clot is then acted. It can act because of the antithrombin 3, by the protein C and protein S, also by plasmin. Now plasmin is formed from plasminogen. Okay. So when this clot is formed, then plasminogen is activated and it is converted to plasmin, which then dissolves the clot. So plasmin also plays a vital role in dissolving of the clot. So when you say hemostasis, it's vasoconstriction, platelet plug. Third is blood clot, that is permanent clot, and fourth is dissolving of the clot, okay, by plasmin, protein C and protein S, antithrombin. So So you see in the blood, there is also these clotting factors are present, and there is also these things are also present. So the balance between these clotting factors and presence of these 4 factors or these 3 factors, it keeps the blood in liquid form. Whenever there is any upset, like for examples, any upsetting of the endothelium. Remember, smoothness of the endothelium plays a vital role. Endothelium is kept in a smooth fashion. Whenever there is any tear or any breakage in the endothelium, this clotting mechanism can start. And when it starts without any actual trauma or tissue injury, then it can lead to thrombosis or thrombus formation. Okay, which is this smoothness of endothelium is also disturbed in cases of like bacterial infections like Shigella toxin. In cases of presence of Shigella toxin, it can be also affected, which can result in hemolytic uremic syndrome when there is bleeding. When there is presence of blood in the urine, when there is kidney failure, decreased RBC count. Okay, so this smoothness of endothelium must be preserved, must be maintained. The moment the endothelium is disturbed and the collagen are exposed to the platelets, then the whole hemostasis mechanism starts taking place. Okay, so this is about hemostasis. So because of the hemostasis, our blood is maintained in liquid form, and because of hemostasis, whenever there is bleeding, there is spontaneous arrest of bleeding. Okay, what we call as hemostasis. So that's for hemostasis, and we'll continue in the next video for other bleeding disorders and others. Thank you.